At Oyate Health Center, self-governance meant taking control of healthcare in a way that reflected what the community was asking for. When tribal leaders, family, and youth were asked what was needed most, the answer was clear: behavioral health. So what happens when young people help shape the care designed for them? Here, care starts with listening and is built for our people.
Made this trip 20 or 30 times because I usually come up at least once a year. I'm 22 now, so about close to 30 times.
We believe that we come from the thunder spirits in our creation story. We welcome them back because we honor their power as we believe the most powerful spiritual entity on earth.
The Great Plains was one of the last holdouts for self-governance. There was a deeply entrenched view that the only way that the federal government could uphold its treaty obligations, because we're treaty tribes. This is where many of those original treaties were agreed upon, is on this land. It was sort of a convergence of the failures of IHS, but also re-educating our tribes that there's more than one way that treaty obligations can be fulfilled. And through self-governance, not only can the treaty obligation be fulfilled, but the tribes are the drivers of what that looks like.
We're in the Black Hills of South Dakota, Rapid City, and we are very close to a lot of reservations. It's a landing spot for a lot of indigenous people and members of the community, but being as it is an urban area, it is removed from a lot of what you would see as far as cultural knowledge and the ability to just ask.
The new facility was one of the ways that we could generate excitement. It was one of the ways that we could talk about implementing a different model for delivering healthcare and share those ideas of what that might look like. When we did our first needs assessment with the community, the number one need that was identified by tribal leaders as well as the community was behavioral health services. And so even while we were negotiating the contract with Indian Health Service, we were also concurrently looking at grants and applying for grants. And that would specifically augment the work that we're doing. We began right away looking at SAMHSA grants and Indian Health Service grants. And we also recognize that where we can make the most difference early on is with our youth. When we had the vision for Oyate Health Center and we talked about being relative-centered, we had a high-level idea of what that would be. But our approaches also came about from talking to the youth themselves and hearing the spiritual hunger that was there.
Didn't have either my parents growing up. My mom was off doing whatever. My dad was in and out of prison, and I spent a lot of time with my grandparents.
So there are a couple things that we did. We started putting behavioral health specialists right in the clinic, and that's made a huge difference. The other program that has made a big difference in our community is connecting with our youth program.
At the core of connecting with our youth and connecting with our youth extension, we utilize culture. Incorporating culture is so important because you feel connected back to your community. We want to incorporate culture into every part where we can. And that means bringing the teachings to the participant. We can do it individually, if that's where they're more comfortable. We can do it in a group setting, or we can also take them to these sites.
My grandparents told me about the traditional ways, but they were quite older, so they couldn't take me to the sun dances. They couldn't take me to the sweats. They couldn't take me to any of that. They could tell me about it. They could tell me the stories, but they couldn't take me to any of it.
The focus there is bringing our youth back to those traditional values, traditional ceremonies, those seasonal ceremonies, those cultural teachings that used to guide and strengthen our people.
At the age of 9, I started using substances on a daily basis. I didn't really have any positive role models or anything. On my 18th birthday, I had attempted suicide, and I was in the hospital, and while I was in the hospital, one of the counselors there told me about the Connecting with Our Youth program. And my 18th birthday, I joined the program, and I stayed in it for several years, and they helped me make a lot of progress. I'm 4 years sober, doing pretty good. I'm getting ready to go to college. I started the program during COVID, actually. And at the time, I really didn't feel connected to the program, but I continued to maintain staying in the program because of the mentorship. One of the things that stuck out to me that she said to me is, do you want feedback or do you just want me to listen? And that was the first time in my life that somebody had actually asked me that, rather than when I tell them something, they get mad at me or upset at me. I knew then that I wanted to stay in the program because I knew that the people there cared about me and they were gonna support me no matter what.
How we operate is we're able to walk with them so that they're not alone. And one of our taglines for our program is Nishnala Mayani Shni, which means you don't walk alone. So tomorrow we're going to take our participants over to Black Elk Speak.
With the Connecting with Our Youth program, they were able to take me to the Sundance. They were able to take me to these sacred places and learn exactly what I do at those places. They were able to take me there where I was able to hang my ties in those places that we pray to. Well, when I was at home, I made tobacco ties. And with each tie, I put in a prayer. And when I go to offer my ties, I always offer tobacco so that they accept my prayers. Actually, all my prayers this year were for the people, for the community, and for specific people that are hurting right now that I know could use the help.
The prophecy is in the 7th generation. The young people which are nearing that 7th generation, the young people we see now, they're learning the language, like I said, and the ceremonies, the songs.
We're one of the last frontiers where self-governance is evolving, and tribes are discovering the strength and opportunities that come with self-governance. Don't let the fear stop you. It is a big change, but don't let it stop you.
I'm changing the cycle in my own life. I'm changing the cycle in my family. I'm changing the cycle of people in the community. And that really motivates me to keep going further so that I can make a bigger impact than what I have now.